Hi, Dr. Lisa Vuich here, Renew MediSpa in Derry, New Hampshire. In this video, you'll watch me perform a MINT PDO thread lift. MINT stands for minimally invasive, non-surgical thread, and MINT PDO threads are the only thread in the US market which are double FDA cleared. Now, PDO threads are dissolvable surgical suture material, which enables us to lift sagging facial structures, sagging skin, into a more uplifted position to make you look more refreshed and more youthful. And as you'll see in this video, the threads are inserted through nothing more than a needle poke. Over time, they will dissolve gradually into just water, but the whole time the threads are there, they're stimulating collagen, and the collagen that they stimulate will last for years. So we've already done this cheek, and now we're doing the ones to your jawline, and then I'll do a U-turn one underneath to get you more cinched up that way. And this is just what's called a cannula that I'm using right now. It basically lays, basically creates the path, and then I slip the thread through it, and the cannula comes out. Okay. So you're just feeling at this point like pressure as I work it. Most people say they can feel they're touching them, but they can't really feel anything sharp or uncomfortable. And that layer doesn't actually have a lot of nerve endings, but we still numb it. So. Alright, so now the thread goes in the cannula. All the way down. And then we get it to catch. And the metal comes out. And the thread stays in. Now these marks on the skin, I just made those with a simple marker, but those are just our planned pattern of threads. Usually it goes as planned, but sometimes we have to make an adjustment on the fly. And this cannula is dull, so as it passes through this soft tissue, it's not injuring anything. They're now getting a little lift. We previously completely disinfected the skin, of course. So it looks kind of creepy and exotic, but at the end of the day, all we're really doing is putting surgical suture into that subcutaneous fatty layer. And because of the way that they're designed, because they've got a little gripper, rough surface, they're able to pick things up a few millimeters. And the more threads we put in, the more result, within reason. And the longer, the more collagen you get, and potentially the longer the result lasts too, so. And we also teach physicians and nurses how to perform these procedures. All right, so this one will look a little bit creepier because it is on a needle instead of a cannula. Okay, watch the thread area that it doesn't touch anything. Thank you. Other than the face, which is already sterilized, which is not a problem. All right, so with this one, we're just gonna get a little more lift of that skin of the upper neck under the jawline. Not pressing on you too much? No. Okay. And again, the whole path was numbed ahead of time, so I'm just making sure that the depth of this as I'm passing it is exactly what I want. No problem here, because the blood vessels we don't want the needle to hit are actually much deeper. So. Okay, that's this section. Still good? Are you feeling anything sharp at all?
No.
No. Good. Now you'll notice in this video that our thread lift model is really not even flinching during the procedure. And that is due to injectable lidocaine, which is a numbing medication, which is placed all along the thread paths, as well as at the entrance and exit points of any threads that actually exit out the tissue. So really all that the client is feeling is touch and tugging. There isn't anything sharp or uncomfortable during the procedure, and that's why she's laying there really so comfortably throughout this video. Collagen is just going to build around the threads. They're basically just going to become all one with the fat. So you're not going to be able to see them or feel them as things settle in. And they ultimately will dissolve just into water, but leave all that collagen behind. Okay. Now, I understand that watching this happen, it may seem invasive, but actually the thread lifting procedure is no more invasive really than dermal filler injections. It takes a little bit more time. It certainly takes more skill to plan the pattern and to deliver the threads. But done well, this is a fairly low downtime procedure, which really is able to help us achieve goals that we could not achieve with Botox and filler alone. We're happy to answer any questions you may have, and we look forward to seeing you at Renew MediSpa.